there's a twofold higher rates of diabetes in South Asia. The number of people with type 2 diabetes going to increase.
32 years ago, I started Excel Lab. Dr. Saab was in US for 20 years. Intervention cardiologist we have, overall cardiologist, the COO of NICVD, which is a cluster of 10 hospitals, Masters in Healthcare Management from Harvard University. जैसे उन्होंने क्वेटा में नया हॉस्पिटल खोला है, आर्या हॉस्पिटल. I welcome you. Please come and give us some knowledge sharing.
Of interventional cardiologists who put stents for a living to be talking about preventive cardiology.
The thing which is different in South Asians is this, like protein A. This is one of the other than questions, of course, as in lab investigation, ideally we should suggest.
सबसे commonest cause of kidney failure in Pakistan is diabetes, which is technically preventable in treatment.
But his claim is for whole family, and they are not having.